YouTube channel. My name is Dorothy Dadibu. I'm a community pharmacist working here in Ghana with one of the largest pharmaceutical firms. On my channel, we'll be talking about tips, resources on health, pharmacy, and I'm sharing real life stories of people living and managing with these conditions and how they survive day to day. This video, we'll be talking about reasons why your medication might just not be working for you, why you're not having the effect that you want to. So stay tuned. Hope you enjoy it. Story. A woman came to the pharmacy one day complaining of a severe headache and inability to sleep. I decided to check her blood pressure, and of course it was skyrocketing. Now she has a history of blood pressure in her family. She herself is hypertensive, and for whatever reason, for some months, she and her friends had embarked on some Untitled journey because they were tired of taking anti-hypertensive medications because they have to take it every day, and her blood pressure was 200/100. The normal range is supposed to be 120/80. Hers was 200/100. We were all shocked because, like, how are you even able to walk in here and come and tell me that you have a headache? I mean, with 200/100, you should be in bed hospitalized, probably with a stroke or something. God being so good, she was walking ambulatory. She came inside, we checked her BP, immediately we referred her to the hospital. Now, her reason was Untitled journey, because they were tired of taking the antihypertensives every day, so they resorted to do their own diets, their own concoctions, and it wasn't helping. And that brings me to my first point. The reason why most of your drugs are not working is because you are not taking them, if not regularly, you are not taking them as prescribed. The thing with drug is, for it to be effective, it needs to have or be at a certain concentration in your body. So if you take it today and tomorrow you don't take it, it's like the concentration increases, it decreases. So you can imagine there's a graph. Just imagine a graph. So it goes up, it comes down, it goes up. It's supposed to be a steady rate, a steady concentration. So if you don't take your medications regularly, it keeps on dropping. So you don't have the full effect of the drug. And secondly, too, if you don't take it as prescribed, you don't take it as the doctor asks you to take, or as your pharmacist asks you to take it, you can also affect the drug, the efficacy of the drug, that is how potent it works, will be affected. This is especially so in patients with chronic diseases like the hypertensive patients, the diabetic patients, HIV patients taking antibiotics, tuberculosis patients taking antibiotics. So in Ghana, we have various methods of dosing or telling people how to take their medications. We actually write the labels either on the plastic paper where we put the medications that are in the sachets in, or the loose medications, or we have a sticker label and then we put it on the medication. There's also verbal communication where the pharmacist can tell you, okay, do this, do this, do this. But this is usually accompanied with the labels that are written or pasted on the prescription, on the drug. On the labels, you find the number of drugs you should take, the time or number of times you should take the drug in a day, it in respect with food, whether you should take it before food, after food, or with food, and also the number of days. So that's 4 things you look out for. So now, just to shed more light on it, so when your doctor says, or when your pharmacist says take a drug twice a day, means you take a tablet 8 a.m, you take the tablet 8 p.m. You don't sleep, maybe you wake up at 12 and decide to take a tablet at 1 and then take your next tablet at 7. That's not what it means by take your tablet 2 times a day. It means take it 12 hours apart. Pharmacist says take your tablet 3 times a day. It means take it every 8 hours. So, and a good example is maybe you take your tablet at 6 a.m, you take your tablet at 2 p.m, and then take your tablet at 10 p.m. 4 times a day means you take your tablet every 6 hours. So 6 a.m, 12 p.m, 6 p.m, 12 a.m. A pharmacist will always work around your schedule to find which time is best for you. So always talk to your pharmacist about that. When it says take your medication after food, it means that after you eat, you take your medication, or you take it within an hour after you've eaten, because then there's still the presence of food in your stomach. And medication like that need food or fat to help it to be absorbed. That's why they actually take it after food. Now when they say take it with food, it means as you're eating, you stop, take your medication, continue eating. Now when it says before food, now this is the tricky part. But if you take a drug 1 hour before you eat, the medication would have been absorbed into your system before food is introduced, and then food will not have effect on the absorption of the medication. Or after you eat, you can wait for 2 hours and then you take your drug. It's also assumed that after 2 hours of eating, the stomach contents are empty, so then you can now take your drug. But please take note of specific times. For instance, a medication like Lipitor, also called atorvastatin, that is used in the treatment of high blood cholesterol, is taken at night. This is a particular time. It can't be taken in the morning or in the afternoon. It's taken just at night. Don't chew when the prescription says swallow. Don't take the capsule, open, pour the powder on your sore when the capsule is meant to be taken. These are all instances where medications are not taken the right way. In a nutshell, always ask for clarification. If you don't understand anything, don't be hesitant to ask your pharmacist or your doctor what they mean by what they've written. I know sometimes whenever your doctor or your pharmacist is talking to you, it's like you don't even understand. On that note, let's move to tip number 2. So number 2, the risk of drug interaction increases the minute you take 2 or more medications. The minute you take medications with certain beverages, food, herbal medications. Now what does it really mean when I say a drug interacts? Now the drug can also interact with another drug when it affects the absorption, the distribution of the drug in your system, how it is excreted from your system, and how the drug is broken down in your blood. One drug can either increase the percentage or concentration of a drug in your blood or decrease the percentage or concentration of another drug in your body. So in this case, it can lead to treatment failure or toxicity. When this happens, this can lead to side effects, can lead to hospitalization, and it can lead to death. So if any of these things happen between 2 drugs, or a drug and a food, or a drug and even a disease condition, or a drug and a beverage, then we say there's a drug interaction. So this commonly use antacid, milk of magnesia, and then another one is Nugel O. Now these drugs are used for indigestion, heartburn, and they're very common in Ghana, over-the-counter drugs. Now these drugs contain aluminium and they also contain magnesium, and these, when taken with other medications, they bind to the medications and form bigger particles. It affects how fast and how much of the other medication is available to your system to use. So in this case, instead of you having maybe 10 amounts of the medication in your body, you're going to have just about 2 or 3. So you take the paracetamol and then the medication, you still have the headache. In the case of diarrhea, food doesn't stay, or the contents of your stomach don't stay there for long. It's always being excreted because you're always running, you're always visiting the loo. So if you take a medication, the medication doesn't stay in your stomach long enough for it to be absorbed. That when you have an ulcer, the pH, which is the acidity of your stomach, is altered. That would also affect the availability of the drug in the blood, like the absorption of the drug into the blood. And also with cancer patients, you know, with chemotherapy and some of the medications they do, they wipe out all the good bacteria in your body and also sometimes in your stomach, and you need these bacteria to be able to absorb medications properly. So make sure you tell your pharmacist what you are taking, what has been prescribed, and what you also bought from the pharmacy. I always say this, that you should be the most knowledgeable about your care. Another thing to note is that you need to limit self-prescriptions. If you are sick, don't ask your friend for a medication unless your friend is a pharmacist. So certain lifestyle habits like drinking can reduce the efficacy or the rate at which your medication, how well your medication will work for you. Now alcohol activates an enzyme in the liver, and now that enzyme causes the metabolism of drugs. So for instance, you take a drug, example is metronidazole. Metronidazole is not supposed to be taken with alcohol. Now if you take it with alcohol, what happens is that it causes the enzyme that metabolizes the drug to not work. So you have the drug in a very high concentration in your body, hence you have very high or very bad side effects or reactions to the drug. Alcoholism is one lifestyle that you need to control when you're taking medication. When you're on medication, especially something for a long time, you need to watch your alcohol intake. If not, you need to watch the time that you're taking the alcohol. If you're a smoker, you're at risk of drug interaction. The nicotine activates liver enzymes. So in this instance, the drug doesn't stay in the body long enough for you to achieve the concentration that your blood needs for it to be effective. So you take a drug and it just doesn't work for you. You need to talk to your pharmacist if you're a smoker or you drink, so they can give you times and work around your schedule to give you like good times that you can take your medication, or give you pertinent advice that will help you when you're taking your medications. Thank you. Now the next topic we are going to talk about is storage. I know most of us keep drugs in our fridge. I don't know why Ghanaians do that. I don't know whether it's just Ghanaians, but we all keep drugs in our fridge. And even though it's a cool, dry place, there are certain medications that shouldn't be stored below room temperature, and there are certain medications that need to be stored below like 0 degrees sometimes. So you need to know this. So instead of putting it on in your fridge or in your car for a while, just so that you always have it, why don't you keep it in a cool, dry place? The term is cool and the term is dry. Don't keep it in a hot, moist place where the drug will be broken down, will disintegrate before you even go and take it. So a good example would be maybe on your shelf in the kitchen. A very aerated shelf in the kitchen. Don't put it on top of your fridge, because sometimes your fridge becomes hot and that is not cool. So the last but not the least tip I'm going to talk about is inappropriate dosing. Now, how does inappropriate dosing come about? Now, a very good example is pill splitting. You know, sometimes medications have this line in between. So when they do that, when it happens, we say that the medication is scored. That means it can be split into two. Some don't. So obviously, the ones that do not are not supposed to be split. Also, medications that you see have XL or LA attached to it are not supposed to be split. These are extended release medications, so they are produced or designed in a certain form such that they are released into your system bit by bit by bit. So you can't split those medications. Please avoid splitting medications that are XL or LA, or medications that do not have the line in between. This is even because when you split them, sometimes you don't even split them well. If you need to split, you need to use a pill cutter. There are small handy machines that are sold in the pharmacies, will help you divide your drugs evenly, so then you know you're taking the right dosage whenever you need it, and not anything less and not more. Another reason why you might be taking a lower dose or a higher dose is if you over exaggerate your condition or you under exaggerate your condition. So if you go to a pharmacy and you have pain, tell a pharmacist, I have pain and it's bad. Then she knows, okay, let me give you a high grade or a very potent painkiller. If you go to your pharmacy and say, okay, my tummy hurts, don't go and say, my tummy hurts, so I am dying, when you know you're not dying. So just keep it simple, keep it honest, keep it clean. Let your pharmacist know the rate of your pain or what exactly you're going to. Don't over exaggerate, don't under exaggerate. Another reason why you might not be getting the appropriate dosage is age. It's a fact that when you're aging, your kidney functions, your liver functions decrease. Okay, so your kidney is not working as it used to, your liver is not working as it used to, so it's not excreting or getting rid of waste substances as fast as it needs to. It's also not breaking down drugs enough or as fast enough for your body to consume it, for your body to use it. Another factor under inappropriate dosing is obesity. Now, there are some drugs that are given or taken per kg. An example is malaria. This malaria drug, artemether lumefantrine, found in Coartem, found in Lonart, found in Malatu, Gen M. These drugs are given per weight, per kg. So now if a child comes, the child is maybe 15 kg, and then you are given a dosage for 25 kg, boom, that's toxicity. That's giving more than you need to. Or the child is 25 kg and you are giving drug worth 15 kg child. No, it won't work. Even if it does, it won't work as well, and then you're gonna have a relapse, and that is treatment failure, and you do not want that. So please make sure that you have your weight in hand, because sometimes you go to a pharmacy, I know you've experienced before, where the pharmacy asks you, do you know the weight of your child, and you're like, I don't know, and then they'll just guess, oh okay, because they are 3, maybe it should be around this, even though it might be correct or it might fall within the gap. It's not accurate, and you don't want to do try and error with your life or your child's life. So please take note of that. Thank you so much for watching this video. I hope you liked it, I hope you enjoyed it, I hope you learned a lot. Most importantly,